Thank you. And again, thank you for not just inviting me for this wonderful function, but also the opportunity to learn from a tremendously educative forenoon and early afternoon. The sessions have very important messages. I was just talking to Nikki out there and I said, listen, I think we need to encapsulate the messages that have come through all the sessions today and maybe bring out some important public health messages which will be of interest through maybe a media capsule. So it's just something that will really make a difference. But I'm here to present my journey to the award and what happened thereafter. So just as a matter of introduction, I'm a pediatric cardiologist and I work at the Amrita Institute in Cochin. And this is something that hasn't sunk into the consciousness of most people, that congenital heart disease has started to become important as infant mortality from a number of other causes have declined. So one of those silent revolutions that have happened in medicine in the last 3 or 4 decades is that children are no longer dying as often from diarrhea and respiratory infections as they used to. But what ended up being neglected in the process is congenital heart disease. Many congenital anomalies, but especially congenital heart disease. So if you look at the situation in the late 90s, there were just 4 centers that had the capability of doing infant heart surgery. And at that point, just 1% of babies in this country were getting timely treatment. For a possible number of 200 to 250,000 children born with congenital heart disease, very little was being done. Those few handful of centers were a couple of them in Delhi, one in Trivandrum and one in Chennai. So this was the situation when we began the pediatric heart program in Amrita Institute of Medical Sciences. And Kerala was ahead because Kerala's infant mortality had declined much earlier than everywhere else. The lines were much lower. As a result, the disease had surfaced to a much greater extent in Kerala, and therefore it was a very important mandate of the Amrita Institute to set up pediatric cardiology. And we laid out our mission and vision because we really wanted to be accessible to every single child in the region. And not just that, we wanted to achieve a high level of excellence with outcomes that match the West. I set my bar at Boston Children's Hospital where I was trained. We wanted to do research that was contextually relevant, and of course we wanted to train the next generation. We set up the program, and that's provided the substrate for the award that I received. And my journey, and just showing you the slides that I showed, it allowed us to give pediatric cardiology an identity. We started the DM program, we started a journal, wrote many books. And most importantly, we really set up a very distinct identity for the specialty which didn't exist in this country. And then, of course, the quality of care was very important. So a hard and difficult journey towards getting outcomes that match the West in the next 25 years. And it's still work in progress. We still have to get better and better, but we are there. We are there with the best. And we can compare ourselves with the best Western institutions in terms of both outcomes and other challenges, despite the fact that we have an incredibly difficult population. Important to really address our contextual challenges, all the innovations we do to reduce our costs, and to look at our patient profile that's rather unique through systematic processes, publications, and research. And this is something that set the stage. But what I'm really proud of is what we could do on the public health sphere, which is to set up a system to improve the continuum of care for congenital heart disease and really make it truly accessible to every child in the state of Kerala through the Hridayam program, which then had a dramatic impact on the infant mortality in the state, which was sort of plateauing at 12. And for the first time, we saw single-digit mortality after we introduced this public health program called Hridayam, where every single child has now access to congenital heart surgery in the state of Kerala. So the thing was really into finding resources for care. And we did have huge challenges in trying to generate the kind of resources that is needed to deliver care for every single child. And this came through institutional charity, it came through partnership with philanthropes, and it came through some help from the government, but this was not enough. We really had to do something more, and that's why we set up the Amrita Heart Care Foundation. And this was constituted as a public trust in 2020, but we were struggling. We really could generate, but we just don't know. We didn't have the wherewithal to get this kind of money that is needed. That's when Jaipuria happened. It happened in 2022. And one of the significant motivations for me to apply for the Jaipuria is because I wanted that 50 lakhs. And that 50 lakhs was transformational. What it did, it really, first of all, allowed us to increase the quantum of care in our own foundation, but show a significant amount of activity that woke up some CSRs. And that has been an exponential story after that. And we've reached a point where we've now been able to do 461 surgeries with this amount. And wouldn't have been possible if I hadn't got this money. And so this transformation continues. We are at the threshold of some much larger grants, impacting states, partnerships with governments. We are on the threshold of a partnership with the state of Jharkhand, with Odisha. So we are hoping to really make a difference to the most poorly served parts of the country through this whole process and through the foundation. This is where we have done a number of outreach camps in the country. We've chosen areas that have really poor access, eastern parts of the country, Kashmir, some really remote parts of Northeast. And of course, as a result, we've really had lots of contributors. I have to acknowledge all of them. But the more important thing is that we really follow these guiding principles, that we have partnerships to address. We make them truly partners in the whole process. We have complete transparency. We have to communicate well. And of course, document, share the stories. So all this has allowed us really to become very optimistic for the future, which is to improve access even further. We want to hit 1,000 surgeries. We've done 900 last year, so we want to hit 1,000 surgeries annually. And of course, try and have a very comprehensive follow-up of the neurodevelopmental status of these children. So we've set up a system through another trust that has given us this incredible ability to look at neurodevelopment, schooling, learning disorders, and we've actually set up a formal project for this purpose called Project Medha that we've now got for neurodevelopmental follow-up of all our children. This is my wonderful team that contributed, without which I couldn't have gotten this award. Thank you.